Orthodontics is the area that prevents and diagnoses and treats dental and facial anomalies. Our goal are for the condyles to sit in position, we want the muscles to relax, and we want for a better periodontal health, ideal functional movements, and the 6 Class 1 occlusion keys. Remember, malocclusion. So what is the meaning of malocclusion? It is a developmental irregularity. Remember that it is not a pathology. Who found orthodontics? Edward H. Engel is the father of orthodontics. He classified the malocclusions. He founded ortho. He invented the appliances for treatment. Now he classified the occlusion. He said that the key of occlusion are by the maxillary first molar. So wherever the first molar is located, that is our key of occlusion. Number 1, or our first classification, is the normal occlusion. That is what we want our treatment outcome to be. So a normal occlusion has a normal molar relationship and all the lines fit on line of occlusion. As you can see here in the picture, this is our what we want the outcome of our treatment to be. In the second classification, class 2 malocclusion, here we have a normal molar relationship, but there are some irregularities in the line of occlusion, as you can see here. Because the ideal position for the molar is for the mesiobuccal cusp to be situated into the center line of the lower first molar. Class 3 malocclusion is when the mesiobuccal groove of the first mandibular molar is distally or posteriorly positioned, and when it's in contact with the maxillary mesiobuccal molar, and the line of occlusion is not specified. As you can see here in this photo, you can see the ideal one, the normal occlusion for the class 1 occlusion or the normal occlusion, we want this mesiobuccal cusp to be here, to be in line with the groove of the lower first molar. But here you can see it's more anterior. Here patients are also referred as the duck smile, because usually these type of patients, they have their upper incisors are protruded to the outside. Last we have class 3 malocclusion. In this classification, the mesiobuccal cusp of the mandibular cusp of the molar occludes mesially to the mesiobuccal groove of the maxillary molar, as you can see here in this photo. So it's more, so the upper jaw in this class 3, the upper jaw is situated more posteriorly to the lower jaw. Now, what is the line of occlusion? So for the upper one, so it's a smooth curve through central fossa of the posterior teeth and cingulum of canines and incisors. Here, you see? So this is the smooth groove that goes from the central fossa, which is here, of the posterior teeth to the cingulum of this is the cingulum of the canine, there, all the way to the other end. And for the lower one is a smooth curve through the buccal cusp. Remember this, it's the buccal cusp. So for the upper jaw, it's from the central fossa of the posterior teeth, while for the lower jaw, it's from the buccal cusp of the posterior teeth and incisal edge of the anterior teeth. The orthodontic anomalies can be dental, could be skeletal, or it could be a combination of all of both these, so dental and skeletal. So diagnosis and the treatment plan depends on the case history. We have to do a very good clinical examination, take good x-rays, CBCT, OPG. This is the cephalometric analysis. What is this? It is the analysis of the relationship between dental and the skeletal in skull. Now, for this diagnostics and the plan, we need to make a 3D model analysis of the occlusion. We have to make space analysis to see if there's enough space or not, to analyze the jaw, and also for the prediction analysis. There's this analysis called the Bolton's analysis, which is the tooth size discrepancy. Okay? We also need to make photographic analysis. So So orthodontic appliances could be removable, or they could be fixed. Now, removable, there is the active form and the functional one. Okay, so active one are the active plate, and functional are the like activators. They can be taken off. So there's like active plates, as you can see here in the picture. We have like bionators here in the picture. So they're basically removable appliances for treatment. And then we have the fixed. Fixed are different materials. We could have the gold alloys like wire or bands, stainless steel, nickel, titanium, and etc. You have to remember that there are different again ways. So we have this edgewise brackets that are more commonly used nowadays. And remember this, that there are 6 keys to normal occlusion. We need to have a molar relationship, crown angulation, crown inclination, so that this crown angulation refers for the tip and crown inclination for the torques. Absence of rotation, tight contacts, and flat curve of speed.